how to perform a minimally invasive hammertoe correction on a fairly rigid hammertoe. I'm one of the professors in the Academy of Ambulatory Foot and Ankle Surgery, and this is a minimally invasive technique. Let me just show you her foot here. She has a foot that's fairly common with a medial drifting second hammertoe here. And so what we're going to do, we're going to approach this by going on a lateral approach here to do a wedge osteotomy on the base of the second as well as on the third to make these toes more aligned and more rectus position. We're going to create osteotomies in the proximal phalanx proximally and also in the middle phalanx, right in the middle diaphyseal bone here. In addition to this, she has a hump in her toe here. We're either going to remove that or perform an additional osteotomy in the distal aspect here, depending on how this reacts with the proximal osteotomy. One of the things I want to talk to you about is some of the original descriptions in correcting hammertoes minimally invasively will basically discuss doing tenotomies. I've kind of moved away from a tenotomy so the patients can continue to have a good mobility in the toe after the surgery. So a lot of this stuff can be actually performed without doing the tenotomy. So what we'll do today, we're going to leave the tendon alone and do mostly bone work to get a correction with this patient. Okay, we're going to begin our hammertoe correction here. Some of the ways we do hammertoe correction in MIS, we do a plantar approach. In this patient, we have a medial drifting toe. So what we're going to do is go on a lateral approach here. So what we do first, we start with our C-arm. We get that in place and just get our exact position where we want to place our incision at. And you can see here on our C-arm there, you can see we can get a good view of our second toe here. Okay, so one of the things we do to get our exact position here is we put our blade in the view of the C-arm, and that'll give us our exact position of where we want to go there. One of the important things in this too is also not to leave any residual bone that needs to be rasped out. You'll see from our previous slide, you look in the middle phalanx, you can see a little piece of tissue there, a little bony break off there. That needs to be removed. That's easily done by taking a small rasp, and we'll show you how to do this. Just kind of denude that side, and that little piece of bone will come out. You see how that comes out fairly easy. That's the part that's kind of left, and you don't want to leave that. It could form a little spur in the toe. It's easy to kind of get out of there. Now let's redo that and look at our C-arm. Now you can see that we've taken a little rasp and we've kind of rasped out that little residual piece of bone there. So you don't want that left in there. That could cause you to have a little spur in the toe. And now everything looks real clear. You can see our osteotomies in the middle phalanx of both the second and third toe. Osteotomies in the proximal phalanx, the second and third, and also an additional osteotomy in the distal diaphyseal of the proximal phalanx second. That will get our proximal phalanx head down. Okay. Well, now we've completed our surgery. See, we've got a good result in straight second and third toes. Your toe, remember, before the surgery was leaning more medially. So what we did a dorsal lateral incision at the base of the proximal phalanx, created a wedge osteotomy which pushed the proximal phalanx head down and over lateral. We did that both for the second and third toes. On the proximal phalanx, you have a little bit of a bump here on the proximal interphalangeal joint. Instead of removing the bump, which is a little bit traumatic to the toe, we perform a second osteotomy in the proximal phalanx, and that will allow us to push that head of that bone down and get a more rapid position. Therefore, we've actually preserved all of our joints. We haven't done any arthroplasties. All of our cuts have been in the diaphyseal or the proximal portions of these bones. In our middle phalanx, we did diaphyseal cuts. But this will heal the toe, and it'll give a good result with a straighter toe, and also she'll have a preservation of her joints as well.